The lifetime risk of developing heart disease after the age of 40, this is for women, is 32%.
That's right.
What do women need to know today?
Women need to know that they're at risk for heart disease. You know, for many years we thought that heart disease was a man's disease and a typical symptom, just like former President Clinton had pressure in the chest. But sometimes the symptoms are more subtle. Shortness of breath, unexplained fatigue. The pressure doesn't have to be in the center of the chest. It's lower down. And you don't know how many of my patients tell me that they thought it was a stomach ache.
Well, especially, I'm guessing this is maybe even more of a challenge with women who tend to, look, I mean, let's be honest, they're the caretakers of their own family, so they tend to blow off and minimize their own symptoms or their own issues.
And in fact, when women go in to have their bypass surgery, we find out that they're more likely to have high blood pressure, diabetes, and when they come to the hospital with their heart attacks, they're more likely to be in heart failure because they delayed taking care of themselves.
Obesity is obviously a contributing factor to this.
A major risk factor for heart disease, particularly in women. Obesity, when you carry your weight around the middle, increases risk for heart disease, and also obesity leads to type 2 diabetes.
And how do we, I mean, it just seems as a country we're getting fatter and fatter. Obesity is really an epidemic in this country.
Obesity
so
is definitely
what is the
an
one thing you
epidemic.
would tell women on that front?
I think they need to pick up and exercise themselves and start modifying their diet. And women need to know that their children are watching and they're setting the example. And if you set the example in the home and start to eat healthier foods, particularly fruits, vegetables, whole grains, non-processed foods, then your children are going to be picking up these lifestyles.